So a couple days before I had my stroke, I had been sick and had been in the hospital. My husband Rob came to come check on me the night of the stroke. I thought I was speaking plainly to him, but he said I wasn't. Jennifer, he's like, go ahead and squeeze my fingers, and put out his hands.
I put 2 fingers up like this on each side. I said, now, wrap your fingers around my hands, and I said, squeeze for all you're worth.
He goes, I don't want to scare you or anything, but I think you're having a stroke. And he immediately then called 911. 911 came up to our house. We had the whole fire department and ambulance, all of Missoula, up at our house.
The paramedics were like, okay, well, do we want to do this, or do we want to just scoop and go? They're like, scoop and go. And they got her on the gurney and out the door and to the hospital. And that's when it was obviously confirmed that she had a hemorrhagic stroke. So she had a brain bleed.
When Miss Owen came into the emergency department, she was having some dysarthria or slurred speech. She had some facial droop, kind of some weakness on the right side of her face. She had paralysis of her right arm. She couldn't move it at all. And she had a little bit of weakness of her right leg. The imaging that we got on Miss Owen showed that she actually had a hemorrhage or a bleed inside the brain.
So the nurses in triage or the medics that we educate use a quick scoring tool. And there's different tools that you can use, but one that is commonly used is the FAST exam. And that's F for face, to look for facial asymmetry. You can ask somebody to smile and see if it's equal on both sides. The A is for arms, and that's ask somebody to lift their arms up or check grip strength to see if it's equal on both sides. The S is for speech. And that's, you can ask them to repeat something or ask them a simple question and see how they respond to that. And the T is for time. And that time of onset is really important in helping us figure out what some of our treatment options may be.
We are aggressive about treating stroke in the very early going. When an artery gets blocked, brain cells start to die within minutes. And that's what a stroke is. It's dead brain cells caused by lack of blood supply. If somebody has symptoms of a stroke, it is imperative that they get themselves to a hospital as soon as possible to see if you're a candidate for a drug that dissolves clots. Afterwards, we can decide if we should be trying something like clot retrieval, and we can make arrangements to do that, but the first thing is to get to a hospital so we can assess people quickly.
Well, oftentimes surgery is more indicated from a neurosurgical standpoint in a hemorrhagic stroke than it is in an ischemic stroke. And whereas there's sometimes a clot that forms causing an ischemic stroke, hemorrhagic strokes are just due to blood leaking out into the brain tissue. And we really want to try to prevent any further blood from leaking out.
They treated her. They did a fantastic job with her. She was up and walking now with assistance, I think either the next day or 2 days later, which she couldn't move when she had the stroke.
What cognitive rehabilitation, what all rehabilitation really focuses on, is doing things that we can't do very well. But we do it in a very targeted and efficient manner, so we optimize the recovery. And what's going on in the brain is just like when I learn a guitar, what we're asking the brain to do is rewire itself. That's called neuroplasticity. We want the brain to start to figure out a different way to do the same task that we've always done. But we can't use part of the brain now because it's dead because of the stroke. So we've got to figure out workarounds to do that.
After that situation, you're not out there looking, okay, who's having a stroke today? You know, you're not out there looking for it. You're like, okay, this happened this one time in my life, great, we got through it, and you don't think about it again.
He knew the things to look for because a few weeks before he'd had a coworker at work that was starting to have a stroke.
My name's Gordon Stabler. I'm the Assistant Director of Engineering here at KECI-TV. I live in Missoula, Montana. I've been here for well over 30 years. The thing that I remember the most about the beginning of the stroke is as I woke up about 2 o'clock in the morning with a really, really bad headache. So I went out into the kitchen and got my water bottle out of the refrigerator and I took a big old drink of water, and the headache kind of went away. And I thought, well, I must have just been dehydrated. So about an hour later, I woke up with another headache. And I thought, well, what's going on here? You know, so I drank a bunch of water again, and the headache went away. And on my way to work, I knew something strange was going on. I remember listening on the radio, and one of the most strangest things that ever happened to me was I knew the song I was listening to. I knew that it was a Beach Boys, and I knew it was the words to the song, but I couldn't remember the name of the song. And then Rob came in, and he was sitting just right over here, and he started talking to me, and I tried to answer him, and he said, Gordie, something's really wrong with you.
I get to work and I get down into Gordie's office, and I sit down and we just start chit-chatting, and then every now and then he would say something that made absolutely no sense. Either the wrong word for the conversation or something just nonsensical that had no meaning to it.
He started slurring his words, not making a lot of sense, and he really knew what was going on before we did.
I made up my mind, well, there's something so wrong with me, I've got to do something, so I packed up my briefcase.
The first thing that we thought of was he needed medical attention immediately. And fortunately, we're right next door to Providence. So that was the next step.
And I admitted myself into ER. And it only took the lady like 2 or 3 seconds to figure out that I was in the middle of having a stroke. The receptionist, she rushed me into trauma 2. And then the stroke team, or whoever it was, took over.
So after Gordon's stroke, which was a surprise to all of us, a few weeks later, our chief engineer's wife also had a stroke. So we had 2 different scenarios. I don't think now looking back, I don't think there are any 2 stroke victims alike, and that's what we saw going through the process. So Rob and Gordie had that connection.
It's hard to have to face on a day-to-day basis, but watching what you eat, making sure that I keep my diabetes in control and in check.
Well, I'm on blood thinners, so that's part of it. I don't have a choice in that part, but I exercise, I get regular exercise, I try to get good rest, I try to sit down and think about the day and stop worrying about what's going on at work. It'll take care of itself. I need to pay more attention to myself. We talk about what I've lost and what Jennifer has lost, and we both are kind of in the same boat. And we can't take a pill that makes our side effects or our effects from the stroke, there's nothing that's going to bring our brain cells back. We are going to have to live with that for the rest of our lives.
I'm administrative assistant or receptionist. Being a secretary or receptionist, you have to type, you have to answer the phones. So a lot of things was getting used to using my left hand. The question is do you want to live or not and see your family and your friends and what's going to happen? I mean, I'm still here today and my son's getting ready to go, he's just finishing up second grade. And now I can be part of his PTO and be a part of his school and see those things.